Bismillahirrahmanirrahim. Today we'll start from axillary artery. The axillary artery, it is the continuation of the subclavian artery. It extends or starts from the outer border of the first rib up to the lower border of the teres major muscle. Then it continues as a brachial artery. The pectoralis minor muscle, it divides the artery into three parts. First part, superior to the muscle, second part, deep to the muscle, and third part is inferior to the muscle. So let's see. So this is the axillary artery. It starts from the outer border of the first rib. This is the first rib. So from outer border it starts, and this is the teres major muscle, and it ends at the lower border of the teres major muscle, and then it continues as a brachial artery. This is the brachial artery, and you can see the pectoralis minor muscle. This is pectoralis minor, which divides the artery into three parts. The first part is above the artery, above the muscle, and the second part is just posterior to the muscle, and third part is just inferior to the muscle. Okay, now let's see what are the branches that come from the axillary artery. The axillary artery gives 6 branches. From the first part, 1 branches arises. From the second part, 2 branches arises, and from the third part, 3 branches arises. So we can remember by 1 for 1, 2 for 2, and 3 for 3. So let's see what are they. From the first part, the axillary artery gives branch, that is the superior thoracic artery. From the second part, thoracoacromial and lateral thoracic artery, and from the third part, anterior circumflex humeral artery, posterior circumflex humeral artery, and subscapular artery. So we can remember this name by a mnemonic. What is this? This is the slap the lawyer and save a patient. Slap the lawyer and save a patient. Okay, so superior thoracic artery stands for slap, thoracoacromial artery stands for D, and lateral thoracic artery stands for the lawyer, and save a patient. Subscapular artery stands for save, and anterior circumflex humeral artery stands for A, and posterior circumflex humeral artery stands for the patient. So slap the lawyer and save a patient. So we can easily remember the name of the branches of the axillary artery. Okay. So let's see the branches. Okay, you can see from the first part 1 branches come, that is the superior thoracic artery. Then from the second part 2 branches come. This is the lateral thoracic artery, and this is the thoracoacromial artery. And from the third part 3 branches come. These are the anterior circumflex humeral artery, posterior circumflex humeral artery, and subscapular artery. So that's all about the axillary artery. Now let's go to our main topics, that is the brachial plexus. The brachial plexus, what is it? It is the plexus of nerve which is formed by the ventral rami of lower four cervical nerves, that are the C5, C6, C7, C8 spinal nerves, and first thoracic spinal nerves, that is the thoracic one, with some little contribution from the C4 and T2 also. So what is it? It is a plexus of nerves which are coming from the ventral rami of the lower four cervical spinal nerves, that are the C5, C6, C7 and C8 spinal nerves, and first thoracic spinal nerves, that is the thoracic 1 spinal nerve, and some little portion coming from the C4 and cervical 4 and thoracic 2 spinal nerves. Now come to what is prefixed brachial plexus. It is the plexus where the C4 contribution from C4 is large but T2 is absent. And what is postfixed brachial plexus? It is a plexus where the combination by T2 is larger but here C4 is absent. Now come to what are the components of brachial plexus. The brachial plexus consists of roots, trunks, division, cord and branches. Among them, roots and trunks, they are located in the neck. Divisions are located behind the clavicle, or we can say retroclavicular portion, and cords are present in the axilla. So in short, we can say roots and trunks are located in the supraclavicular region. The divisions are located in the retroclavicular region, and cords are present in the infraclavicular region. Okay. So in the axilla, we can see the cords of the brachial plexus. We can remember these components of brachial plexus by a mnemonic, that is the really tired and drink cold beer. Really tired, so drink cold beer. R for the roots, T for the trunks, D for divisions, C for cords and B for branch. So the mnemonic is really tired and drink cold beer. So these are the root, trunk, then come division, then cord, and at last the component is branches. Now let's start from the roots. The roots, they are constituted by the anterior or ventral rami of spinal nerves of C5, C6, C7, C8 and thoracic 1, and some portion comes from the C4 and C2. Now come to the trunks. There are three trunks: upper trunk, middle trunk and lower trunk. The upper trunk is formed by the root of cervical 5 and cervical 6. The middle trunk, it comes from the root cervical 7, and lower trunk is formed by the union of cervical 8 and thoracic 1 root. Now division. So what are the division? There are two division from the each trunk. That means upper trunk divide into anterior and posterior division, middle trunk also divide into anterior and posterior division, and lower trunk also divide into anterior and posterior division. That means each trunk divide into two divisions. Then come to the cords. There are three cords: lateral cord, medial cord and posterior cord. The lateral cord, it is formed by the union of anterior divisions of the upper trunk and anterior divisions of the middle trunk. The medial cord, it is formed by the anterior division of the lower trunk only. But the posterior cord, it is formed by the union of posterior divisions of all three trunks. That means posterior cord is formed by the posterior divisions of upper trunk, middle trunk, and lower trunk. Then come to the branches. Okay, from the root there are three branches. From root there are two branches, nerve to the serratus anterior and nerve to the rhomboids, or another name is dorsal scapular nerve. From trunk, on the upper trunk give branches, two nerves. These are the suprascapular nerve and nerve to the subclavius. From the lateral cord, the branches are lateral pectoral nerve, musculocutaneous nerve, and lateral root of the median nerve. And from the medial cord, the branches are medial pectoral nerve, medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, and ulnar nerve. And the last one is the medial root of the median nerve. Then what are the branches coming from the posterior cord? Upper subscapular, lower subscapular, nerve to the latissimus dorsi, or another name is thoracodorsal nerve, axillary nerve, and radial nerve. So let's see what they look like. So this is a very good picture of brachial plexus. You can see the roots. We have already told you that there are 5 roots. These are the cervical 5, cervical 6, cervical 7, cervical 8, and thoracic 1. And from the 5 roots, so we are talking about the brachial plexus. So there are 5 roots. These are the cervical 5, cervical 6, cervical 7, cervical 8, and cervical and thoracic 1. So then they form trunks. This is the upper trunk, this is the medial trunk, and this is the lateral trunk. This is the inferior trunk. Upper, medial, and inferior trunk. The upper trunk is formed by the union of cervical 5 and cervical 6 root, and the medial trunk is formed by the cervical 7, and the inferior or lower trunk is formed by the cervical 8 and thoracic 1 root. Then each trunk is divided into 2 divisions, anterior and posterior divisions. Look at that, this upper trunk is divided into anterior division, posterior division. Middle trunk is further divided into anterior division and posterior division, and inferior trunk also divided into anterior division and posterior division. Then come to cords. There are 3 cords: lateral cord, this is medial cord, and this is posterior cord. How they are formed? The lateral cord is formed by the anterior division of the upper trunk and anterior division of the middle trunk. They together form the lateral cord. And then come to the medial cord. The medial cord is formed by the anterior division of the inferior trunk or lower trunk. Then come to the posterior cord. This posterior cord is formed by the posterior division of all 3 trunks. That means posterior division of the upper trunk, posterior division of the middle trunk. So the posterior cord, it is formed by the posterior division of the upper trunk, posterior division of the middle trunk, and posterior division of the lower or inferior trunk. Together is form the posterior cord. Now come to the branches. What are the branches coming from the each cord? At first, we start from the root. Okay, we can see in the root there are two branches. One is dorsal scapular. This is the dorsal scapular nerve, and the second one is long thoracic nerve. The dorsal scapular nerve, it arising from the cervical 5, and the long thoracic nerve arising from the cervical 5, cervical 6 and cervical 7. This is the long thoracic nerve. So from root there are two divisions. One is dorsal scapular and another one is long thoracic nerve. Then come to the trunk. From trunk there are two branches, and these two branches coming from only from the upper trunk. So what are they? So from the upper trunk only two branches arise. These are the suprascapular and nerve to the subclavius. So there are two branches. Then each trunk is divided into anterior and posterior division. Then from the branches from the cord. Okay. From the lateral cord, this is the lateral cord. So in the lateral cord, from the lateral cord there are three branches. Number one is lateral pectoral nerve. This is the lateral pectoral nerve. Number two is musculocutaneous nerve. This is musculocutaneous nerve. And number three is lateral root of the median nerve. This is the lateral root of the median nerve. So three branches coming from the lateral cord. Lateral pectoral nerve. So three branches coming from the lateral cord. These are the lateral pectoral nerve, musculocutaneous nerve and lateral root of the median nerve. Then come to the medial cord. From the medial cord the branches are coming. These are the medial pectoral nerve, medial pectoral nerve, medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm and medial root of the median nerve. So these are the branches of coming from the medial cord. Then come to the posterior cord. From the posterior cord the branches are upper sub. So what are the branches coming from the posterior cord? They are the upper subscapular, lower subscapular and thoracodorsal nerve, and it gives branch to the axillary nerve and as well as radial nerve. This is the axillary nerve and this is the radial nerve. So branches coming from the posterior cord: upper subscapular, lower subscapular, thoracodorsal nerve and axillary nerve, and this is the radial nerve. Okay, so we can remember the branches from the cord by a mnemonic, that is the MARMO. Okay, musculocutaneous nerve, axillary nerve, radial nerve, then median nerve, and at last this is the ulnar nerve. Okay, so MARMU, MARMO. So these are the branches coming from the cord. You have to know the root value of each single nerve. Okay, so let's see. From the roots we have seen that two branches come. These are the nerve to the serratus anterior or long thoracic nerve. Its root value is C5, C6, C7 and it supplies the serratus anterior muscle. And when this muscle paralyzed, one clinical condition arises, that is the winging of scapula. Then nerve to the rhomboids or dorsal scapular nerve. It supplies the rhomboidus major and rhomboidus minor muscle as well as some part of levator scapula. Then from the trunk there are two branches, suprascapular and nerve to the subclavius. Suprascapular root value is C5, C6 and supplies the supraspinatus and infraspinatus muscle, and nerve to the subclavius supplies the subclavius muscle. Now branches from the lateral cord. We have seen three branches: lateral pectoral nerve, musculocutaneous nerve, and lateral root of the median nerve. Their root value, all of their root value are cervical 5 to cervical 7. The lateral pectoral nerve supplies the pectoralis major and minor muscle, and musculocutaneous nerve supplies the muscle of the anterior compartment of the arm. So these are the biceps brachii, brachialis, and coracobrachialis muscles. And now come to the medial cord. The branches are medial pectoral nerve, which supplies the pectoralis major and minor muscle, medial cutaneous nerve of the arm, which supplies the medial cutaneous structure of the medial part of the arm, and medial cutaneous nerve of the forearm. It supplies the medial part of the forearm, and then ulnar nerve. The ulnar nerve supplies the intrinsic muscle of the hand. The ulnar nerve supplies the intrinsic muscles of the hand, except first and second lumbricals and thinner muscles. These first, second lumbricals and thinner muscles, these are supplied by the median nerve. Okay, and ulnar nerve also supplies two muscles in the forearm. These are the flexor carpi ulnaris and medial part of the flexor digitorum profundus muscle. And next branch is the medial root of the median nerve. These together, medial root of the median nerve and lateral root of the median nerve, they together form the median nerve. And the root value of median nerve is all the roots, that means cervical 5 to thoracic 1. Then come to the posterior cord. This is the upper subscapular, lower subscapular. Their root value are C5 and C6, and they supply the subscapular muscles. This subscapular muscle is located on the dorsal surface of the ventral surface of the scapula. Then nerve to the latissimus dorsi. Another name is thoracodorsal. Root value is C6, C7, C8, and it supplies the latissimus dorsi. And axillary nerve root value is C5, C6, and it supplies the deltoid muscle and teres minor muscle. And the radial nerve, its root value comes from the all roots, that means cervical 5 to thoracic 1, and it supplies all the muscles in the back of the arm and forearm, because the radial nerve lies posterior part of the humerus. So naturally it will supply the muscles of the back of the arm and forearm. And the median nerve, it supplies all the muscles of the front of the forearm except flexor carpi ulnaris and medial part of the flexor digitorum profundus, because we already told that these two muscles are supplied by the ulnar nerve. Then come to one clinical condition, that is Erb's paralysis. So before knowing about Erb's paralysis, we have to know about Erb's point. Erb's point is a point on the upper trunk of the brachial plexus where 6 nerves meet together. So what are they? So let's see the Erb's point. Here 6 nerves meet. This is the root C5 and C6. These two roots together join to form the upper trunk. This is the upper trunk. From the upper trunk, we have already seen 2 branches arise. These are the suprascapular nerve and nerve to the subclavius. And then each trunk, that means from the upper trunk, there are 2 divisions arise, anterior division and posterior division. This is the anterior division and this is the posterior division. So look at that. 1, 2, 3, 4, 5 and 6. 6 nerves meet together in this point. So this point is called Arp's point. So if any injury occurs this point, the clinical condition is called Arp's paralysis. So what will be the clinical presentations or clinical features in this condition? This condition is called policeman tips hand. Okay, policeman tips hand. Here the arm is adducted and medially rotated, and the forearm is, look at that, the forearm is pronated and extended. So in Arp's paralysis, the arm is adducted and medially rotated, and forearm is pronated and extended. So let's see what is the Arp's paralysis. So Arp paralysis, here the injury occurs in the upper brachial plexus or upper trunk of the brachial plexus. Where it happens, the injury happens in the upper trunk of the brachial plexus. Here 6 nerves meet, cervical 5, cervical 6, which gives to 2 nerves, nerve of the subclavius and suprascapular nerve of it, suprascapular nerve, then divides into anterior and posterior division. An injury to the upper trunk at this point is called Arp paralysis. What are the causes of this injury? Undue separation of the head from the shoulder, which is commonly encountered during birth injury, fall on the shoulder, and during an anesthetic procedure. And the nerves here mainly involved are C5 and C6. This will be C6. And muscles paralyzed mainly are biceps brachii, deltoid, brachialis, and brachioradialis. What are the deformities we can see in the arm? In the arm is adducted and medially rotated, and in the forearm it is extended and pronated. And this deformity is simply called as policeman's tip hand, or waiter's tip hand, or porter's tip hand. So this is all about the Arp's paralysis. Now let's learn about another clinical condition that is called Klumpke's paralysis. We already told you about the Arp's paralysis, that the injury occurs in the upper trunk of the brachial plexus. But in case of Klumpke's paralysis, the injury occurs in the lower trunk of the brachial plexus. And what are the causes of injury? The undue abduction of the arm, as in clutching something with the hands after a fall from a height, and sometimes seen in the birth injury. And the nerve roots are involved, mainly cervical 8 and thoracic 1. Muscles that are paralyzed in this clinical condition, these are the intrinsic muscles of the hand and ulnar flexors of the wrist and fingers. And this condition is called claw hand. So what will be the clinical picture or clinical presentation? There will be hyperextensions at the metacarpophalangeal joint of the hand and flexion at the interphalangeal joint. There will be complete claw hand. There will be cutaneous anesthesia over the ulnar border of the forearm and hand, and there will be a clinical condition, horn. This is a very good picture of the Klumpke's paralysis. You can see when someone falls from a height and suddenly he catches a structures. So there is undue abduction of the shoulder joint, okay, and there is injury of the lower trunk of the brachial plexus, and it produces the clinical condition Klumpke's paralysis. And it can also occur during delivery. We know during normal delivery of a baby, the head comes first. If the hands come first and we pull it with some force, then there will be some undue stretching of the shoulder joint, and there will be injury to the lower trunk of the brachial plexus and lead to the Klumpke's paralysis. So here is the clinical pictures of Klumpke's paralysis. There will be complete claw hand, and the nerve root here are involved. These are the cervical 8 and thoracic 1. So we told you that there will be hyperextension of the metacarpophalangeal joint. These are the metacarpophalangeal joint. So these joints are hyperextended, and interphalangeal joints are flexed. These joints are the interphalangeal joint. You can see there are flexion of the interphalangeal joint and hyperextension of the metacarpophalangeal joint. This produces a clinical condition. It's called complete claw hand. It is seen in the Klumpke's paralysis. So that's all about the Klumpke's paralysis.